Natasha, thank you so much for joining us.
Hi.
We've had a consultation off camera where we've gone through all the medical things, but can you just summarize for us, please, what your main concerns are?
Yeah, I can. Mainly loss of volume, which is sort of making it a bit sort of loose here and giving lines there. Having lost a bit of weight, I feel like I've lost volume in my face overall.
Yeah. And we were saying, remind me how old you are again?
I'm 53.
53, fine.
Yeah.
So you've got the natural volume that you would lose because of aging, and then when you're used to having more volume on your face and then you lose that weight, it suddenly feels like...
The downside. It does feel a bit like, it's a bit,
You can't win with it. And you've had treatments done in the past. You've had some cheek filler in the past. You've had some temple filler, some under eye filler, little bits here and there.
Yeah.
And you've always found that has helped add some of that structure and support back in.
Absolutely.
If there was one thing that we could target today, what would that be?
I think slightly under the eyes, if it's possible to do something there. But the main thing is just to bring, instead of my face doing that, bring it that way. That's what I notice, is just lifting it slightly so that I'm not so jowly.
Yeah.
And just pulling it up and making me look a bit fresher.
Okay. We'll have a look. So, for our examination, what we do is we look at things from superior to inferior, lateral to medial, and then deep to superficial. And by doing this, it means that we can avoid exactly the thing you're concerned about, adding too much volume medially, superficially, and lower down, which, if anything, is probably going to accentuate that heaviness in the lower face. We want that lovely, as you put it, that triangle of youth, which is having most of the volume supporting, not necessarily lifting, but supporting back here, adding the structure in, and reducing the amount we need medially. So with that in mind, I just want to point out initially, your cheekbones are insane. They look amazing. And we don't want to add too much volume there. If we do that, it's going to make everything above it and beneath it, so the temples and the pre-auricular, look a little bit more hollow. So actually, we're going to leave this be today. In the temple here, we can see, particularly just above the tail of the brow here, there is that little bit of hollowing there, as well as some more diffuse hollowing, partly accentuated by your lovely cheekbones here. And in the pre-auricular, again, we've got lower cheekbones and a bit of hollowing and loss of support back there. So the two places that we can start would be the temple and the pre-auricular area. Once we're done with that, we're going to shift our focus a little bit more medial onto the apex of the cheek. We can see lots of projection here, but on the apex, which is in line with our SOOF or our suborbicularis oculi fat, there is just, I can see particularly from this angle here, a bit of flattening coming medially towards the deep medial cheek fat, and then some loss of support in the Pyriform fossa as the maxilla has slowly resorbed over the last few years. So in one fell swoop, we can treat the apex, the deep medial cheek fat, and the Pyriform fossa to add that support back in. And as we get support here, it's going to help add some structure and scaffolding for the lower face down here. Once we have added that support there, we can then, maybe if we think we need to, add just a very, very small amount of a soft product directly into the under eye area here. So as a bit of a recap, we've got our tear trough, which is just this tiny little area medially here. And then as we come laterally, we have our palpebromalar groove, or PMG, which is a little bit easier to say. This groove here is something that lots of people have concerns about because it automatically makes them feel a bit more tired or look a bit more tired, even if they feel fine. The first step would always be to add that structure in deep and inferiorly, and then if needs be, add a little bit in underneath the muscle to bring that groove forwards, soften the shadow, and give the impression of looking a little bit more awake. Does that sound okay to you?
Sounds great. Thank you.
Wonderful. Let's do it.
Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our injectables diploma. So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. And over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics. If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like.
As mentioned, we're going to be starting up in the temple here. At temple, we've got our temporal crest as our superior border. We've got our orbital rim anteriorly here. We've got the superior border of the zygoma inferiorly. And then we've got our hairline posteriorly. I'm always palpating to see if I can feel the superficial temporal artery, which I can, and that's back in the hairline here, coming slightly anteriorly as we move cranially up there. I can't feel anything pulsing away anteriorly in the temple. Three main techniques we can use in the temple. We've either got cannula in layer 2 in the subcutaneous fat. We can do our so-called gunshot technique, which is a deep supraperiosteal bolus in the one up, one over formation. Or we can go into the interfascial plane, which is what I'm doing today. And that's using a 22 gauge cannula, a medium to high G prime product. And we're going underneath the superficial temporal fascia. And I'm going to be approaching that from an entry point on the forehead here. So in terms of our gem staging, this is actually on our gem stage 3. So we wouldn't recommend, just turn your head towards me slightly. That's great there. Wouldn't recommend doing this until you're feeling a lot more confident with all of the stage 2 procedures. And that's roughly after around 2,000 filler cases. So I'm making my entry point on the forehead here, and this is one of the few injections, you can feel the sharp scratch, well done. This is one of the few pilot entry points where I go all the way down to layer 5. For the most part, we just want to be subcutaneous, but here we want to really make sure that we're underneath the frontalis muscle so that we can glide nice and easily into that interfascial plane. I'm just pinching that there. This is layer 2. I want to carry on with my pilot entry point. I'm pinching and you'll see a little bit of resistance. Natasha, you might feel a bit of a pop here. There we go. Well done. Perfect. This is a relatively closed up space. And so we can, once we get some product in there, which has got the anesthetic, we can open that space up and it gets a lot more comfortable, a lot more quickly. So I'm starting anteriorly and just fanning product and opening up this space anterior to posterior. It's normal to see a little bit of distension of the veins around here. But we can see already how much more easily that product is, and the cannula is moving within this interfascial space here.
So we choose to inject in this space because we know that there's no arteries in this particular plane, and that means that Max can feel quite comfortable when he's injecting with his cannula. Having said that, there are veins. There's something called the sentinel vein, and that's why we have to be very gentle with our movements, because if we lacerate that vein, we can end up with a venous bruise or a venous hematoma. And so it's always worth pressing after injection just to minimize the risk of any deep bruising. And a firm massage is often helpful as well.
So if I take off my markings there, you can see, if you just turn your head towards the middle here, that lovely sense of fullness on the right compared to the left there. And that's not with a huge amount of product either. That's 0.5 over that whole temple area. But it's a nice balance, that interfascial plane, of being superficial enough that you don't need a lot of volume to get a good result, but deep enough that you're underneath a layer that is continuous with the SMAS in the mid and lower face. So you get some support to the under eye area, the mid face and the lower face. And Natasha, apart from that initial little bit of discomfort, how did that feel?
It was fine. It was just, it was a bit weird pop.
Yeah.
But once that, it wasn't painful. It was just odd.
Okay. So next we're going to come on to the mid face, now that we've added that support up in the temples and got some support and traction on the SMAS. So we can divide the mid face into the medial mid face and the lateral mid face, and the dividing line is going to be our line of ligaments. So that will be, from the mid face down, our lateral orbital thickening in this area here. Not wet. It will be our zygomaticocutaneous ligament here, and then our mandibular retaining ligament down here. So we've got this line all the way down like so. So everything lateral to this, if you give me a really, really big smile, we can see is mostly immobile. And then everything medial to that is very mobile. And it's very relaxed again. So we need to be mindful, if we're adding filler superficially and medially, we are sitting on top of the lip elevators, and that filler is going to move around with animation. So typically we want to be nice and deep when we're medial to the line of ligaments, but laterally we can use firmer products more superficially to provide that support and restore the volume loss over the zygoma and in the lateral cheek fat over here.
Perfect. So what products are we going to use here, Max?
So in the SOOF here on the cheek apex, we're going to use Contour. And then in the deep medial cheek and the Pyriform fossa, we're going to be using Rejuvenation shape. I'm going to be treating the cheek apex with a needle down onto layer 5. And how we find the cheek apex is actually really by looking. It's an aesthetic point that lines up with an anatomical point, which is our SOOF. But if you struggle to look and see where it is, then we can use some guidance. So we can feel the orbital rim here. We've got the medial portion and the lateral portion, and we can draw a line straight down from that over the zygoma. And we will be able to see that our apex is just here. If you're still struggling, we can draw a line from the alar of the nose directly out. And where those lines converge, that again will be our apex point. And that is exactly the point where the medial SOOF and the lateral SOOF meet. So you're going to feel a sharp scratch just on the cheek here. I'm supporting the tissues, keeping them under tension, sharp scratch. Onto layer 5, stabilizing, aspirating, 5, 4, 3, 2, and 1. And then doing a nice slow injection. Slow injections minimize the risk of acute product displacement. And this is going to be a 0.3 milliliter injection. And I can see that the skin looks nice and healthy and that we're adding really nice volume there. And coming back again, really nice and slowly. It's a really high impact area, this. And then I'm going to be using Rejuvenation shape in the medial midface. The pilot entry point is somewhere where we can access everything. But if you're unsure, good point, line with the orbit and the base of the nose. Sharp scratch in 3, 2, and 1. Keeping the skin under tension. So layer 2, we're going to see that resistance there. Bit of a pop. There we go. Now we're underneath our SMAS layer. We actually want to be a little bit deeper underneath our lip elevators. So you'll see a little bit more resistance, and there we go. So now we're in our true deep medial cheek fat, and your cannula should be gliding nice and easily in this space. So I'm always moving my cannula, just gently fanning it in the deep medial cheek fat. As a rule of thumb, if you feel resistance, that normally means you're not quite in the right place. And now I'm going to be coming across to the deep pyriform space. This one often feels a little bit pinchy. Well done. There we go. And I can feel my cannula tip there. Well done. And I'm just doing a bolus here. It's going to feel very numb in just a second. Injecting nice and slowly.
So what Max is showing here is actually a very technical approach to reaching that deeper compartment of the medial midface, and often it's easy to get there with a needle, but to get there with a cannula there are multiple layers to pass through. And so again, navigating those layers requires a deep understanding of anatomy, as Max explained very well. But if you can manage it with a cannula, you can treat through multiple zones with a single entry point, minimize trauma, and you also potentially have the lower risk of the product displacing into the wrong tissue as well. So this looks really, really nice. We've treated the deep fat and we've treated down to address a sense of maxillary recession. And I can see here the lift to the cheek as well. So it's looking really, really good, Max.
The deep pyriform space is often a little bit uncomfortable. Lots of nerves there. But it goes very numb very quickly, and it's quite normal to get a numb top lip as well after that treatment. Very good. So next we're going to look at, drop a little bit more inferiorly into this pre-auricular space here. And for that, I'm going to be using Rejuvenation Contour, which is again another high G prime filler within the Rejuvenation range. So the pre-auricular space is from the inferior border of the zygoma all the way back to the tragus, and will extend down with the lateral cheek fat down towards the gonial or mandibular angle. So I'm making my entry point, checking no little vein, skin under tension, sharp scratch. Well done. Just into layer 2 subcutaneously. Staying in layer 2. In some people you will feel a little bit of resistance here. Actually, in Natasha it's going nice and smoothly. I'm doing retrograde threads all the way back to the tragus. I'm not depositing product in this area here. I don't want it accumulating there, but I am coming almost all the way back to my pilot entry point so that I can pivot, change my direction, and then come back.
And you can see Max here is controlling his depth very well, and that's really important in this area. If we go too deep, we can end up in the salivary gland, the parotid gland, which wouldn't be painful for our patient, but it would increase the risk of long-term complications with filler. And so staying just under the skin is the right depth for this treatment.
And it's quite normal as well in this area with those threads of filler you place to feel a little bit irregular. This is an area that is worth massaging after the treatment. And actually one of the few areas that I tell patients that if they're washing their face for the next few days and they feel that it's a little bit lumpy there, this is something that they can also massage themselves as well. Finally, now we've added that deeper structural support and we've put some tension on the orbicularis retaining ligament from the temple, we can treat directly in the under eye area. And if we look at the left compared to the right, we can actually see that the tear trough on the left is deeper and angled down more vertically than it is on the right hand side where we've added this lift to it. So we really don't need much product here. And in the tear trough or under eye area in general, the less product we add, the better, always. So we could actually use the same entry point that I used down here, but I'm going to come just a little bit higher. The less distance that I have makes it a bit easier for me technically. So I'm coming just medial to the cheek apex. You're going to feel a sharp scratch in 3, 2, and 1. Even though I'm going to be treating underneath the muscle here, my pilot needle is only going subcutaneously. Turn your head a little bit to the left. That's perfect. So we're in layer 2 here now, and we're just going to be diving underneath orbicularis oculi. You see that tension, and I felt that give there. So it looks like we're still quite superficial, but we are underneath the muscle. Immediately, and if I lift up the tip of my cannula and feel, I can just feel the tip under there. There's a little bit of fat pad herniation, so I'm just treating the area where the orbicularis retaining ligament is adhered to the skin beneath that fat pad herniation. If I'm in that area of herniated fat, I'm going to make the tear trough look deeper. And tiny, tiny little micro aliquots, stopping injecting, reassessing. Stopping injecting, coming all the way out. And then bring your head back to the middle. So from this angle particularly, I can see that that hollowing has almost completely softened there. At the moment, it looks like I could add a little bit more. But we know that even a product like Rejuvenation Revise is made up of hyaluronic acid. It's still hydrophilic and it will attract some water to it. If I treat this to 100%, we'll see that in a couple of weeks' time that ends up quite puffy. And as we can see in straight on, the right side of the whole face, but particularly under eye, has the impression of being lifted, supported. We can see starting at the temples, we've got this lovely fullness here that's put some tension to the under eye area and the lateral orbital thickening here. Without touching the cheekbones and only treating the pre-auricular, we can see that the lower face here and the jawline just looks like it is that little bit sharper, and even the corner of the mouth looks somewhat lifted. That's been accentuated by adding some deeper support in the apex or the SOOF, the deep medial cheek fat, and the deep piriform space. And by adding that support, we've been able to apply really small amounts, 0.2 milliliters of hyaluronic acid filler to the tear trough region itself. And overall, when we compare that side to that side, we've given a significantly more refreshed and open appearance. So we are all done. In total, we treated the temple area, we treated in the interfascial plane, treated the apex of the cheek here, the deep medial cheek fat, the Pyriform fossa, the pre-auricular area, and just a little drop in the under eye area in the tear trough. We can see that there has been a significant improvement already, and this is before the product's even settled. And if we look there and then turn towards me slightly, so both the under eye area, the midface particularly, and the support that it's added to the lower face and defined what was already a very well-defined jawline. How did that all go for you?
Yeah, really good. Thank you.
Nice.
Yeah.
Wonderful.
Thank you.
So we'll see how everything settles in, and then in the next few weeks we'll get the final results and see how you are then.
What we learnt in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results.
Thank you so much for coming back, Natasha. And it's been around 2 to 3 weeks since we last did our treatment. And just to recap, we treated the temples, all along the cheek here, the under eye area and the tear trough. We did some treatment in the Pyriform fossa and a little bit in the lower face as well. Tell me, how did you find everything during the treatment, after the treatment?
During the treatment, it was a lot more comfortable than I thought it might be. A little bit painful around the temples, and that was the area that was a little bit sort of tend up afterwards, but not for very long. A little bit of bruising, but nothing major at all. That was literally the only area where I had a tiny bit of bruising.
Wonderful. And I can see there's just a little bit of bruising there at the moment. Yeah. Just turn that way there. We mentioned before that there's that sentinel vein in the interfascial plane, and there's some swelling there at the moment. The tenderness that Natasha's describing and a little bit of bruising there does suggest that there was probably a bit of bleeding from that. Long term, no problems at all, but that does explain that swelling, bruising, and a bit of discomfort. And I think we even spoke about that as I was doing that area, but it shows up a little bit later than that. But apart from that, if you turn your head there, we can see we've got really beautiful projection on the cheekbones here, on the apex. And back this way, the under eye area, we'll show you the before and afters after this, but we can see that there's a lot of softening in that subtle hollowing that was there, that's come from both the support in the midface, the apex, the SOOF, deep medial cheek fat, as well as some direct treatment in the tear trough. And there's this stage here, 2 to 3 weeks time, if we were to be worried about swelling from the hydrophilic nature of hyaluronic acid, we'd have seen that by now. So I'm very happy that the result we've got now is a result that we are going to have. So if you turn towards me, you can see on both sides there that lovely fullness under the eyes and there, but no swelling. If someone didn't know you, and even if they did know you, I don't think they would know you've had all of the treatment that you had, not even that long ago.
No, nobody mentioned it at all. Which I'm a bit annoyed about. I think that's great. I think that's great because you don't want people to notice necessarily.
No, it's
as much. So yeah, no, it was fine. I'm for it. My back's fresh.
I think about.
Yeah, I do a lot. Yeah.
Awesome. Thanks so much, Natasha.
My pleasure. Thank you.